I'm not sure. I think it still does it.
All right, we'll give it one more minute and then we'll go ahead and get started. I think we've still got a few people joining. All right, well, we'll go ahead and get started. You might hear a couple more people joining in, and that's totally fine. So good afternoon, everybody, and welcome. My name is Natalie Littlefield, and I am going to be your moderator and host for today's conversation. I serve as the Community Impact Director here in Central and Eastern Kentucky. And today what we're going to be doing is discussing COVID-19, what those living with cardiovascular disease should be aware of in the changing pandemic. We'll have a conversation about COVID-19 for the general public and some resources that we have available as we navigate this challenging time together. A warm welcome as we all join this conversation today. Thank you guys for joining us. As we begin our conversation, please feel free to use the chat option in this Zoom call to send comments and questions as our conversation today evolves. We're going to be having a Q&A session towards the end of today's meeting together. We're going to have a physician leadership panel first, and then we'll transition to the Q&A section after that. We will be having some additional community conversations next Friday, April 24th, as well as Friday, May 1st. And I'll tell you guys a little bit more about that later on in today's call. And now I'm going to introduce our panelists for today's community conversation. So I'm pleased to introduce these experts and would like to take a moment to thank them for their time today and bringing their expertise to today's conversation during what we know is a very, very busy time and a challenging time for them. So if you all could please join me in welcoming our panelists. We have Dr. Mark Greer. He is the medical director for Bechtel BGC APP, and he's also our Central Kentucky AHA board president. So welcome, Dr. Greer.
Hello.
Next, we have Dr. Khalid Ziada. Dr. Ziada is a professor of medicine and cardiology for the Gill Foundation, and he's also the clinical chief of cardiology for the Gill Heart and Vascular Institute at the University of Kentucky. So Dr. Ziada, thank you so much for joining us.
Thank you for having me.
Absolutely. Up next, we have Dr. Robert Salih. He is a cardiothoracic surgeon at CHI St. Joseph Health here in Lexington. So Dr. Salih, thank you so much for joining us.
It's a pleasure to be here.
And then we will also hear a little bit today from Jessica Black. Jessica is our National Vice President of Community Health for the American Heart Association. So Jessica, thank you so much for joining us. Let's see if we can go to Jessica real quick. I have to unmute you. So there you go, Jessica.
Thanks for having me.
Absolutely. Thanks for joining us. All right, well, thank you everyone for being here, and let's go ahead and begin. And just a reminder, if you have any questions along the way as we go throughout the panel today that you'd like answered, please put them in the chat box, and then we will be fielding those as they come in during the Q&A section of our meeting today. So the first question we have today is for Dr. Greer. Dr. Greer, can you talk a little bit about what is the latest in terms of the pandemic in the Lexington community?
Yes, absolutely, Natalie. And thank you to the American Heart Association for hosting this and letting me be a part. With any type of conversation, obviously I'll give my typical legal disclosures that this is my opinion and interpretation, not that of my employer, American Heart Association, yada, 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 and I have no financial interest. And I imagine that goes with all of the audiences or the presenters as well. So current guidance on issues that we see here in Lexington is really around preventing and reducing the spread of COVID. You know, we've all heard about the social distancing, we've heard about hygiene and how to take care of that. There's also guidance and issues out there that we need to be aware of that's found on some of the local county or Lexington Fayette County Health Department, kentuckycovid19.kentucky.gov, as well as CDC. And that also involves protecting against scams and fraud, community needs, support, areas where we can social distance and give back to the community, even unemployment issues. So basically, all of the guidance around this area is still ongoing with education, testing potential cases, social distance, and et cetera. So why are we doing all this? In essence, we're here doing this to protect the vulnerable and those that are higher risk. Those are our older adults that are age 60, 65 and above, or those with comorbid conditions such as cardiovascular disease, diabetes, anything that could immunocompromise that individual. And we're also here to identify and potentially mitigate any newly infected persons and prevent those that are symptomatic or those that are asymptomatic also from shedding the virus and spreading that to others. So specifics in Lexington regarding cases and deaths. Right now we're at 213 diagnosed cases, and unfortunately there have been 7 deaths here in the Lexington area. Those that are most affected are those really ranging from age 18 to 74, but the greatest number of hospitalizations, those with the most severe issues, are in the age group of 55 to 74. In the state of Kentucky, we've had 2,429 cases and 129 deaths, and that is from the last bit of information that I saw on April 16th, yesterday, around 1,600. Natalie?
Thank you, Dr. Greer. Dr. Salih, the next question is for you. As our community practices social distancing and adheres to the governor's stay-at-home recommendations, do you have any tips and strategies to support health and wellness during this time?
The major concerns really with social distancing means that you're trying to limit your interaction with the public in general. And that means paying very close attention to mental wellness as well as physical wellness, because we have to remember that the most common issue with social distancing and being in isolation is mental impact and how that affects our psychic and how it affects our social safety nets and social support groups. So to help people in dealing with some of these stress concerns, the most important is to stay in touch with your core family group and family and friends so that you have that support, and we have the capability with internet access to maintain that type of connection even though we are practicing social distancing. The second part is to pay attention to your physical well-being. A lot of issues concerning this isolation component is that people are being very sedentary and not moving around. We need to have these people being active. We need to make sure that people are doing exercises every day, spending as much time as they can on their feet as opposed to on their bottom, so that we can try to make sure that they're utilizing relatively low impact exercise routines to help with their physical wellness as well. But paying attention to those two major areas, your mental wellness and your physical wellness, is going to be the best way to deal with the external stresses of social isolation.
Absolutely. Thank you. Dr. Ziada, do you have any advice on what you should do if you experience COVID-19 symptoms?
Yes, thanks, Natalie, for that question. That's important. Dr. Greer alluded to the fact that this disease has much more serious consequences on the elderly and also on some of the patients with chronic diseases like diabetes and high blood pressure and obesity and other things. And these are the types of patients that we see as in the cardiovascular world. These are the same predisposing conditions, and so these are very frequently are our patients, and the more are the ones that are more vulnerable in the community. The most important thing with symptoms in this patient population is to recognize that these could be signs of infection, and that they need attention. I think the first step is probably to call your doctor. You can call your primary care physician or call your cardiologist. Many of us have very long relationships with our cardiac patients and stroke patients, and they may reach out to us as cardiologists, not necessarily in the primary care role or to their primary care physician, but either one. You can get advice about the types of symptoms that you're having, whether these need more attention or just need further observation or monitoring. You can also get advice about the need for testing. If somebody is having significant symptoms, they may need to be tested. The testing capacity, as you know, has been a bit of an issue, but I will say that this is getting better and better nationally, as well as in Kentucky, as well as in Lexington. There's much more likelihood of getting a test when you need one nowadays. If the symptoms are severe enough, causing serious shortness of breath or serious difficulty with breathing, that would require probably a higher level of attention or a level of care, and that may require going to an emergency department or calling 911. I emphasize that it's important to pay attention to all the symptoms. There's a wide spectrum of them, and the advice that the patients will get from their doctor is going to vary by the severity of that. The milder symptoms might just require some monitoring. Maybe a little bit more of those may require specific testing for coronavirus, and the more severe ones may require hospitalization. But in any case, these should not be ignored, because the types of patients that we generally work with are the types of patients who are most susceptible to the bad outcomes of this disease.
Absolutely. Thank you. Dr. Greer, can you talk a little bit about the recommendations for social distancing and some of the implications that that can have on our community?
Yeah, definitely. There's a lot of guidance out there, and oftentimes it's kind of difficult to wade through all the different locations that might have information to send to you. So that's one of the nice things. If you can find some website that you trust, like the American Heart Association or the CDC, and you can work through kind of these areas of main guidance, that'll kind of help keep you focused, because there, again, is a lot of information out there. Lexington, again, Fayette County Health Department has information as well. So in essence, the guidelines that are available are pretty vast. So at least here in the Kentucky, Lexington area, all the community gatherings have been canceled. So that has a lot of impact, not only on the individuals, but also on businesses. School districts have been closed. There's really a stay-at-home guidance that's out there, except for essential services, and also to avoid all non-essential travel, such as flying, cruise travel, even going out of the state might be an issue. You should also avoid any type of public transportation, ride-sharing type stuff, because that puts you in close proximity with individuals who may or may not be shedding virus. And then also from a corporate standpoint or a work standpoint, employees, if possible, should be able to work from home. Another avenue that's really of a lot of benefit is all of these different businesses have employees. If they can tune into specific areas of guidance like the Heart Association or the CDC or KentuckyCovid19.com, they should then help relay that information to the employees to be actively participating in kind of the social distancing. And also, just like Dr. Salih and Dr. Ziada just spoke about, it kind of keeps community, it keeps you active, involved in your social environment. And that's important not only for now, maintaining obviously mental health, but also for the future when we roll back into kind of more of a quote unquote norm type environment. Other guidance and stuff out there is if you do need to go out and shop for food or medicine at the grocery store or whatever, again, maintain social distancing, which is, in essence, 6 feet away from other people. And kind of my advice for people is fingertips. Think of fingertips. If you can reach out and touch somebody with a fully extended arm and they can do the same, then you're a little too close. So back up from there. If you can use mail order for prescriptions, that's a great way. There's also a lot of delivery with grocery stores, or you can have it your grocery list prepackaged and ready for you when you get there, so you can kind of limit the interaction with other people. It's also recommended that everybody wear a cloth face cover of some sort. It doesn't have to be a high-tech, N95, P95, N100, etc., but at least something to put over your face. Not really as much to protect you as it is to potentially protect those individuals that you might come in contact with. And that overall is a good, generalization of the different guidelines out there.
Yeah, that's great. Thank you.
Yeah.
Dr. Ziada, as a cardiologist, what suggestions would you make that heart disease and stroke patients and/or survivors can do to best protect themselves during this pandemic?
Yeah, I think again, it's important to make sure that our patients with survivors of heart disease and stroke are aware that all these recommendations and pretty much everything we're trying to do during this pandemic is geared at protecting them. These are patients are usually in the age group that is more susceptible. They have the pre-existing conditions that can lead to bad outcomes. And so we're trying to do all these initiatives and all these changes in the way we're living our lives now to protect them. So they will, as Dr. Greer mentioned, need to abide by the guidelines, probably more, strict into a more strict degree than anybody else. So the best way to protect yourself from the possibility of getting this infection is social distancing. Minimizing contact with others, staying at home as much as possible, minimizing trips outside the home, using the resources that we have nowadays that maybe we never had before, like ordering medications by mail service, or using pre-ordering of groceries and using contactless pickups. All these maneuvers are made to minimize contact with others. That's the first part. The second part is paying close attention to hygiene and hand washing. As simple as that sounds, it actually is a proven and a very effective way to prevent infection. And you can't do that enough. The more you're able to do that, the better. And then the last thing is sort of the answer to my previous question, which is if you do have symptoms, take them seriously. Even if they're mild, I'm not saying you need to rush to a hospital, but at least talk about it with your doctor. Make sure that your doctor is aware that you're having some symptoms. There may be a simpler explanation. There may be a need for a little bit more monitoring, and there may be need for testing. And so it's important that that our patients, the heart and stroke survivors, not neglect or ignore symptoms that can be suggestive of this disease.
Great, and thank you so much. Dr. Salih, the next question was for you, and I think Dr. Ziada talked a little bit about it, but what should you do if you do experience coronavirus symptoms? Is there anything you want to add to what Dr. Ziada recommended?
Well, I think that being aware of what the most common symptoms are, interestingly, the most common symptom with early infection is fatigue, and it can be quite severe in some cases. The second is coughing or sneezing, which is often described as an unrelenting cough. And that cough is frequently associated with chest pain or discomfort in the chest when coughing. And then you've heard of some of these other symptoms that are coming to light, such as the inability to taste or smell, which seems to be a relatively common finding in patients, even with very minor symptoms. And the other is remembering that if you have comorbid difficulties such as chronic obstructive lung disease or emphysema, asthma, cardiac disease, history of prior neurologic or renal problems can all make infection more severe. And so what we come back to in trying to close the circle around that is that we have to adopt a mindset that makes the assumption that everyone that we really don't know for sure is infected with COVID, and that we have to make the assumption that when we are out in public, that every person we come in contact with may be infected. So your goal is to avoid yourself becoming infected, and you may have minimal symptoms and be infected yourself, and you don't want to infect anyone else. So just a sidebar to some of Dr. Greer's previous comments is that wearing a mask out in public is very important, but it also helps keep you from touching your face, which we know is a way that the virus can be spread to yourself. And all of the studies have shown that touching your face may happen as many as 20 times a minute. So we, by wearing a mask, can help remind ourselves to not touch our face and to practice good hand washing.
Absolutely. Those are great recommendations. Thank you. Dr. Ziada, we know that hospitals are strained right now, but should I still call 911 if I think I might be having a heart attack or stroke? And then can you describe what some of the signs or symptoms of a heart attack or stroke are?
Yeah, of course. So to very quickly answer your question, the answer is absolutely yes. Heart attacks and strokes are not stopping because of coronavirus pandemic. They're still happening, and if patients are susceptible to these conditions, they may have them. They will be just as serious as they would have been in any other time. So it's really important not to ignore that and not to try to push this aside. Any symptoms of heart attack or stroke would require calling 911 and seeking attention very, very promptly. The hospitals are strained and maybe strained further in the next few weeks. Hopefully not, but they may be. But we have been preparing very, very well in making sure that there are protections, making sure that infected patients are taken care of on one side, non-infected patients are taken care of just as they used to before on a different side, separating the floors, making sure that patients who are more susceptible but are not infected do not get that infection. So the hospitals and the emergency departments are aware of the patient's concerns and are addressing them. And the risk of trying to deal with a heart attack or a stroke at home is much, much higher than seeking attention the way you would have in any other time. This is causing some of the reluctance to call 911 and go to the emergency room, has been causing some significantly worse outcomes in places like New York City, and we don't want that to happen here. And we want to learn from mistakes or from adverse events that happened in other parts of the country and other parts of the world. Anytime there are heart attack or stroke symptoms, you definitely need to call 911. So heart attack symptoms are usually the classic chest pain. The pain can be pressure, can be more like a discomfort. It doesn't have to be sharp pain. It may be in the chest only, but it can go to the arm or the neck or the jaw. It's usually associated with some degree of shortness of breath. Usually or commonly there is some sweating. Some patients have more nausea associated with that. These are the most common things that happen when a heart attack is evolving. As far as a stroke goes, it's usually difficulty with feeling or difficulty with the ability to move an arm or a leg, sometimes asymmetry of the face, difficulty with speech, sometimes some difficulty with understanding or confusion, and sometimes the difficulty when one is having a problem feeling one of the limbs, the lower limbs, or having weakness in one of the lower limbs that can cause to loss of balance. So these are the types of symptoms that are suggestive of a stroke. Sometimes they come and go. The same thing with heart attacks, actually. The symptoms can come and go. once somebody feels these types of symptoms, they need to seek attention immediately.
Thank you so much. We're going to switch gears a little bit and hear from Jessica Black with the AHA. So Jessica, I'll make sure you're not on mute. Can you hear me?
I can hear you.
Wonderful. Let's see how we can get there you are.
Yeah.
Okay, so Jessica, this next question's for you. Can you tell us a little bit about how the AHA is responding to COVID-19 in terms of research, supplies, and some policy work that we're doing as an organization?
Yeah, our mission is to be a relentless force for longer, healthier lives. And certainly the current crisis makes that as important, if not more important than ever. And so we've really been leveraging every element of the association to focus on both the current crisis, but also then thinking in terms of sort of long-term and sustainability and how do we really help be on track for healthier lives in the long term. So one of the things we were able to do very quickly on the research front was actually pull together a $2.5 million rapid response fund that was made available immediately to get grants out in order to help kind of answer some questions that had just emerged around the treatment of patients with cardiovascular disease and COVID-19. 40% of the patients who are hospitalized have either cardiovascular or cardiocerebral issues or disease at baseline. So it's a critically important piece of the work, and that's certainly underway. Similarly, when we think about sort of that healthcare piece, our Get With The Guidelines platform, which is our quality care platform, was able to move very quickly to establish a registry so that hospitals could better manage their findings as they were moving through this space. And then we were also able to offer a free jobs aid around oxygenation and resuscitation for COVID-19 patients, which is such a specialty issue. On the advocacy front, we've been involved at the federal, state, and local level. There's a lot going on in that space, and we're fortunate that we actually have advocacy legs in all of those places in every state in the country. So we've been very involved in the stimulus packages that have been moving, or the CARES packages that have been moving at the federal level, making sure there's sufficient resources in place for community response, be it in the healthcare realm or in the social services realm. For instance, in many of our communities, including Lexington, we work a lot on the nutrition security front, making sure that families have adequate nutrition so that they can stay healthy and avoid cardiovascular and cardiocerebral disease down the road. And of course, schools being closed has put a major burden on communities because many students count on that as their primary meals in the day, both lunch and breakfast in many cases, and in some cases even supper. One of the things that had to happen in order for the school districts to be able to continue serving students as they have so amazingly well, despite a million challenges, is that there had to be some flexibility in the regulations. And so our federal advocacy team, in partnership with a lot of other organizations who also care about this space, worked really closely with both Congress and USDA to make sure that there was sufficient funding as well as flexibility in the regulations so that students could continue to get those meals. And it's just one example of a lot of work happening in that space. On the outpatient clinical side, in addition to what's happening in hospitals, we recognize, as has been mentioned, that many patients are still needing to manage their chronic diseases. And so working with our outpatient partners on making sure that they can adapt and work with patients who may not be coming in for appointments, who might otherwise usually come in for regular blood pressure checks or cholesterol checks or type 2 diabetes checks. And so as we start to sort of pivot the system to be able to manage remotely, the hope is also that we'll be laying the groundwork for some of that work long-term that may also be helpful to patients' home monitoring and taking better care of themselves in the long term. So really working across that continuum. But the final piece of the puzzle I'll mention is the direct-to-consumer piece. So both at the national level and at the local level, we recognize that, when people are social distancing and they're home, there are some challenges out there that they need to be facing: staying active, eating healthy, managing stress, etc. So we have lots of information curated on our website available for people. We're launching a Move More campaign, which provides free workouts for folks to kind of tune into on a daily basis starting next week. And so if they're looking for some way to be inspired and work out and feel connected, that's a great opportunity. Or locally, on May 9th, we will have the Kentucky Heart Walk, just as we always do, except instead of pulling everybody together, it will be virtually connected. And so we really invite people to, go to the website and sign up to be a part of that Central Kentucky Heart Walk, and, lace up their sneakers and walk where they are at a safe distance from others, but walk with your family, take selfies, post them on the website in order to really feel a part of that energy moving forward.
That's great. Thank you, Jessica. And then you kind of touched on recommendations as far as where to look for resources, but do you have any recommendations for how do you determine what's a trusted health source and what's not? And then a little bit about where people can find those resources on our website.
Yeah, and I think Dr. Greer touched on this a little bit as well. Unfortunately, crisis can also open the door to bad actors, and not all of the information available is quality information. And sometimes it's just confusing because there's so much information. So we absolutely invite people to come to our website at heart.org. We have, revamped the homepage so that it has everything folks need to know, but also then refers them to other reputable places to find additional information. Places like the CDC, the Center for Disease Control, is obviously, kind of a headquarters of what's going on and a great resource at times like these. Your local hospitals and physicians are also a terrific resource, as you've heard here today, in terms of what's happening locally and also kind of what you should be doing to manage things. So, sticking with those sort of specified resources and not spending too much time, Googling far afield can really help people to sort of narrow in on what's reliable and then also manage some of the mixed messages that they might be seeing out there.
Absolutely. Thank you so much. So that's all the questions we had prepared for our panelists. So the next portion that we'll move on to is our Q&A portion. So we've been fielding those questions from the chat box, and if you guys want to go ahead and submit any questions as you have them, we'll go ahead and get started with that portion of our time together today. I'll go ahead and kick us off with a few questions that we have. So Dr. Ziada, is there any point in this pandemic that we should consider stopping taking our medications?
There has been some of that conversation going on, specifically to some medications that we use for high blood pressure and for heart failure. The answer is probably no. We don't stop the medications. There is not enough evidence to suggest that any medications being stopped is going to help with any of the outcomes at this point. So I think as long as the patients are in good health, they should not stop taking their medicine. If there is any symptom or sign that is of concern, they should definitely consult with their physician before stopping any medications. I would not recommend doing that without a consultation with your doctor.
Great, thank you. Dr. Salih, should you take any supplements to help boost your immunity to COVID? Are there any supplements or remedies that have been proven to boost your immunity?
Well, it's interesting because supplements in this country are almost epidemic. It seems like everybody's on something to supplement something or to manage something, but we have virtually no really scientific information or data to support the use of supplements, particularly in this particular era of COVID-19. We're not aware of any supplements that may be of any benefit to patients. And remember that often the supplements that are sold over the counter, for example, are not FDA approved. They haven't undergone any scientific investigation, and they may have significant interaction with other things that the person may be on. So I would be somewhat skeptical and cynical when it comes to the use of supplements during this era.
Thank you for that recommendation. Dr. Greer, why do some people recover from COVID-19 so much quicker than others? Is there anything linked to how fast an individual recovers?
So there's not really a good answer for that right now. I think maybe in 2 years we might know more information about it as this disease process unfolds and we're able to collect all the data. It could be linked to comorbid diseases. Obviously, if you have comorbid diseases, you're at greater risk for more significant illness. It could also be for those who have just very minor symptoms, their actual exposure to virus and how the virus replicates in the body. So unfortunately, there's not a good answer yet, and hopefully in 2 years we'll be able to answer that.
Thank you. Dr. Ziada, can you tell us a little bit about the status of heart disease in Kentucky? How many Kentuckians do we know have heart disease?
I don't want to give you a number that I'm not sure of, but I can tell you that we are unfortunately one of the one of the states that have heart disease and stroke at a very high prevalence. Usually we are not only have higher prevalence of disease, but also have higher prevalence of mortality from heart disease and mortality from stroke, suggesting that we have severe disease or not very properly controlled disease conditions. And so this is one of our public health problems, probably one of our biggest public health problems in Kentucky. There are variations in the distribution of disease across different parts of the state, but generally speaking, Kentucky ranks very low in cardiovascular health across the United States.
Thank you, Dr. Ziada. And we have another question. So we have a UK heart transplant recipient that just received a new heart about 5 months ago today with us on the call. Can you talk a little bit about them potentially being at increased risk? Are they at increased risk? And then can you talk a little bit about how many COVID-19 patients are currently being treated at UK hospital? And for the rest of the physicians on the phone, are your hospitals seeing an influx of patients being hospitalized?
Yeah, we have 10 inpatients right now, and we have tested, I think, over 800 or 900 positive patients. Is that correct? I think so. But we have only 10 patients that are requiring hospitalization. We have a number of those that are requiring ventilation in the intensive care unit, so they have the severe form of the disease. That changes every day, but I think we have at least a few of those 10 in the intensive care unit. Yeah, I'm sorry, the positive tests were 117 and the inpatients are 10. We are not having a massive influx. Some of the models suggest that this can happen later in April or maybe in May. We are hoping that with social distancing practiced aggressively and practiced strictly, we will not have that surge or that influx. But we have a lot of preparations in place, and contingency plans are being developed and tweaked every day in case that happens, in addition to providing and surging our resources as well. As far as the heart transplant patient, 5 months ago, unfortunately, I will have to say yes, this patient is at increased risk of infection in general. One of the things we do when we transplant a heart is that we have to give some immune suppression medications to allow the body to accept the new heart or the donated heart. And so the immune system of the body is weaker than its normal state because of the medications. And so heart transplant patients are susceptible to infections. We are still seeing transplant patients in the hospital because they need care, and we are going to extreme measures to keep them away from any possibility of infection, and trying to create pathways for them from the time they get into the hospital to the time they get to their get their needed care and then leave the hospital completely away from any possibility of infection. But they are at increased risk because of their immune suppression.
Thank you. Dr. Salih, I think this question would be for you. What about D3? This person heard a doctor on another program say Americans, especially African Americans, are deficient, and that presents many health challenges relative to COVID-19.
Well, D3, that would be vitamin 3 derivative. And so with vitamin D, frequently, some of the more recent information would suggest that many individuals are low on their routine levels of vitamin D, and that supplements may be of benefit. There's also some anecdotal information that is not necessarily well supported in the literature that vitamin D may be an immune enhancer, that it may actually boost immunity in some individuals. We do know, of course, that Black individuals are at greater risk, it seems, for developing the serious complications related to COVID-19. And one of those risk factors that's more common in the Black population is hypertension. And hypertension has been found to be a risk factor for enhanced symptoms and severity of symptoms with COVID-19 infection. So I think in this particular population, we know that it seems to have been hit more severely than other populations. And so it just points out how important it is for any individual, whatever race it may be, to manage their blood pressure well, to take care of good physical activity and taking good care of your overall physical well-being. But that's an important communication to have with your physician, to make sure that you're having good control of any symptoms of high blood pressure or other diagnoses that you may have. And that's a discussion that needs to occur with your physician.
Great advice, thank you. Dr. Greer, this question is specifically around the malaria drug. Are there any side effects to the malaria drug, particularly that would be adverse to heart disease patients? I think you might be on mute.
So I think at least on the, there we go. How's that? Apologies.
That's great.
So there's a lot of information out there on the news regarding whether this is a safe medication, whether it's not a safe medication, various different side effects. Any side effects that you might have from the malarial drugs, you should really discuss with the provider who's prescribing that. Overall, I think it's, in the large scope of things, is very safe. It's one that's been used many times throughout the military and as well as individuals in locations that might be potentially exposed to malaria. So yes, there are side effects from that. Those that are increased risk of cardiovascular disease very well may experience maybe an increased risk of these side effects or potential to experience those. And those should be carefully discussed with the provider who's prescribing the medication and close understanding of what those side effects are.
Thank you. Dr. Ziada, how close do you think we are in Kentucky in terms to flattening the curve? How do you think we're doing?
It's a difficult question. You know, you don't know you're at the peak until you're off the peak. But I think the numbers look good. I think that it seems that the growth in cases, the number of new cases, the percentage of new cases reported every day is not going up by much, despite the fact that we're testing more. So that's a positive sign. The second thing is that the rate of doubling of infection is also not increasing at a high level. In fact, it seems like at the end of March, which coincides with 2 weeks after we started social distancing, that rate of doubling increase, which means, or the time it takes for doubling increase, which means that the infection spread is slowing. So there are encouraging signs that we are doing well, but based on some modeling, especially models from the University of Washington, which I follow closely, and I think they are being followed by the National Task Force as well. I think that the expected peak of resource utilization or resource needs in Kentucky is late April, early May. And so we are not out of the woods yet, but I think that the signs, as much as the signs can tell us, they look good.
That's great, thank you. The next question is for Jessica. So Jessica, can you talk a little bit about what the American Heart Association is doing to address health disparities among disenfranchised populations as it relates to COVID-19?
Yeah, we've been working in this space through a number of angles prior to COVID-19. And certainly COVID-19 has recently really shown a light on where those disparities are and the increased risk to certain populations. And so we've been working on kind of a number of fronts. I mentioned the research front, and certainly focusing on how we can be most effective in different populations as we go. Also working a lot on the messaging front and making sure that people are aware and that we're sort of tailoring our materials and tailoring our consumer outreach to the different audiences who may want or need them, to make sure that they too are receiving that. One of the risks that we're finding that's in populations, it also just has to do with who sort of is able to socially distance and who is still in the workforce and still having more interaction. And so thinking about, how can we support people who continue to be on the front lines, either because they're working in healthcare, or because they're working in grocery stores, or because they're working in other kinds of first response where their jobs are still, very present. And how can we make sure that they're getting the information and the resources they need? We've worked with a lot of clinics, federally qualified health clinics or others who are treating higher risk patients, to identify how we can better kind of bridge some of the gaps caused by lack of connectivity or lack of internet access or lack of home monitoring cuffs or other things. And then of course on the advocacy front, we're really focused on, through that equity lens, as we're thinking about what can be done in either the federal advocacy packages that are looking at bringing resources to communities and resources to individuals, and then how those are being utilized at the state and local level to make sure that we're really getting those resources to the people in greatest need, and who are at the greatest risk in this current circumstance.
That's great. Thank you, Jessica. This is going to be our last question that we have time for on today's call. This is for Dr. Salih. Can you talk a little bit about immunity to COVID-19? If you were to get COVID-19, would you build up some sort of immunity to where you couldn't get it again, or would there be a possibility that you could get it again?
Well, that's a wonderful question, because that's having a lot of debate. This particular virus falls into many of the frequently common cold viruses, which people can have a cold, develop a short-term immunity, and then become susceptible again at some point in the future. I think that our current thinking in regards to immunity around this particular infection is that it may not give one lifelong immunity, and that susceptibility can reoccur. And we know of many cases that are out there now where patients have been reinfected with this virus after having had a previous infection. So that's going to have significant implications when it comes to developing vaccines that may be effective. And we have to be very cognizant that that multiple areas within the body can be affected by this virus. And if we are not going to get lifelong immunity from it, how are we as individuals and as a society as a whole, and with our recommendations regarding our overall protection of ourselves moving forward? It's going to be a very, very difficult question.
Absolutely, thank you. So let's close with some last minute thoughts. To our panelists, Dr. Greer, Dr. Ziada, and Dr. Sully, do you guys have any final thoughts as we close our time together today?
Yeah, I'll jump in. And I think just as we've said before, there's a lot of great information out there, but using heart.org and the CDC, as well as your own personal business that you may work for, you may own, to kind of push this message down in a unified front, following kind of the guidelines is really the main thing. To get the information as cutting edge as we can. And we all have to realize this disease is a new disease process that we've seen in the pandemic environment. And there's new information on a daily basis. And as you can see across the world, there's different blooms of cases that's happening. And so we just have to be aware and kind of go and roll with the punches.
I would just add, this is a tough time for everybody, for the healthcare systems and their expectation and our role and our ability to provide care, but also a tough time because of social isolation and social distancing is hard. But I think we're doing well. I think this is the right thing to do. I think we just need to hang on for a little bit longer. Especially in the last 3 or 4 days, I think we are seeing a light at the end of the tunnel. We just need to hang on and just persevere maybe a few more weeks.
And I think I would like to echo the panelists and all who have talked about these issues and remind ourselves that we have and are blessed with a very sophisticated medical community. We have the resources of the university, we have wonderful community hospitals, and a very, very high quality cadre of physicians that we have access to for our patients. And I would remind each and every one of you to take good care of yourselves, support yourselves and your families, maintain those relationships so that you have both mental and physical support within your individual groups. And lastly, take advantage of organizations like the American Heart Association and the CDC and our state level resources, because the state of Kentucky has done a very good job. It's been a leader in the management of this particular infection. So take advantage of that and keep yourselves safe.
Yeah, and to that end, I would invite you to join us. So if you come to heart.org, there are lots of ways to get involved. You know, if you're looking for physical activity, move more, or join us on May 9th for the virtual walk and post your selfies so that you can inspire others. Join us via, lots of people are leveraging their opportunities now or their time to try to help others. It feels good to reach out and help others. And we've actually launched a social media campaign, the hashtag Show Us You're Good, which is an opportunity to really kind of demonstrate what we're doing, be that giving blood or sheltering a pet or taking care of a neighbor or dropping off groceries for someone or donating to a nonprofit or whatever you're able to do that helps kind of keep us all connected and feeling better despite our separation and isolation. So thank you for hosting, and we invite you to continue to join us in the cause forward.
Absolutely. Thank you guys so much. And we are going to be sending out more information after this meeting. So if you wouldn't mind to put your email in the chat box, let us know your name and your email so we can follow up with you with some of these resources that we've talked about today. And we're also going to be having 2 more community conversations just like this. Next Friday, we'll be having a community conversation that focuses on how do we build healthy communities and keep our communities healthy during COVID-19, and then how do we build healthy homes? Because we know that a lot of our home environments have changed. We're now teachers overnight and parents and working from home, and just a lot is different in the home. So how do we keep the home healthy during COVID-19? And then the following Friday, May the 1st, we're going to have some great experts on our call talking about how we keep the workforce healthy as we transition back into offices and kind of what that will look like. We know it will look a little bit different, but we'll have some more information about how to keep your workplace healthy May the 1st. So send your email to us in the chat box and we will follow up with that information. In closing, I just want to say thank you again to our panelists, to our attendees, and a big thank you to all the healthcare teams across the region right now that are working so hard. Your dedication and focus on the health of our communities is truly inspiring. We also want to thank our local heroes, those that are putting their lives on the line to heal our community and keep us safe. The many doctors, nurses, healthcare workers, first responders, grocery store employees, the list goes on and on. We see you working tirelessly and effortlessly through it all, and we thank you from the bottom of our hearts. And to our listeners, we will email you all these resources that we've discussed here today, and we look forward to continuing the conversation as we plan our future community conversations with Lexington, and we will keep your feedback and your needs in mind. So thank you all again, stay well, and have a great weekend.
Thank you.
Thank you all.
Thank you all.
Thank you.